the personal stories and experiences of trans youth who are affected by these laws, and how they cope with the lack of access to healthcare and support. Transgender and non-binary youth are among the most vulnerable and marginalized groups in society. They face discrimination, harassment, violence and rejection from their families, peers and communities. They also struggle with their own identity and body image, especially during puberty, when their physical appearance may not match their gender identity. To cope with these challenges, many trans youth seek gender-affirming medical care, such as puberty blockers and hormone therapies. These treatments can help them align their body with their gender identity, reduce their distress and improve their mental health. According to the American Academy of Pediatrics, gender-affirming care is safe, effective and life-saving for trans youth. However, in recent years, several states have introduced or passed bills that would ban or restrict gender-affirming care for trans youth. These bills are based on misinformation, fear and prejudice, and ignore the scientific evidence and medical consensus on the benefits of this care. They also violate the human rights and dignity of trans youth, who deserve respect and support for who they are. In this section, we will hear from some of the trans youth who are affected by these laws, and how they cope with the lack of access to health care and support. Riley is a 14-year-old trans girl who lives in Arkansas. She started taking puberty blockers when she was 12, after being diagnosed with gender dysphoria by a licensed therapist. She says the blockers have helped her feel more comfortable in her own skin and avoid unwanted changes like facial hair and a deep voice. She also says they have given her time to explore her identity and plan for her future. But in April 2021, Arkansas became the first state to pass a law that bans gender-affirming care for trans youth. The law prohibits doctors from providing puberty blockers or hormone therapies to anyone under 18, even with parental consent. It also allows private insurers to refuse to cover this care for anyone of any age. Riley says she is terrified of what will happen if she has to stop taking her blockers. She says she will experience severe depression, anxiety and suicidal thoughts. She also says she will lose her hope and confidence in herself. To cope with this situation, Riley has joined a lawsuit against the law, along with 3 other trans youth and 2 doctors. She says she hopes the court will block the law from taking effect in July 2021, and protect her right to access the care she needs. She also says she relies on the support of her parents, friends, and online community. She says they help her feel less alone and more empowered. She says she wants to use her voice to advocate for herself and other trans youth who are facing similar challenges. Kai is a 16-year-old trans boy who lives in Texas. He started taking testosterone when he was 15, after getting approval from his parents and his doctor. He says the hormone therapy has helped him develop masculine features like facial hair and a deeper voice. He also says it has helped him feel more confident and happy with himself.